Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor. I'm here with Coach John, and we are about to show you how to do the Cuban press.
Cuban press, yes.
Which was one of your recommendations for coming fresh from an injury rehab and trying to start your workout,
Yes.
right?
So the Cuban press is going to help us increase our scapular stability and essentially our back tightness against the bench when we're pressing. And so I use this as I'm warming up in the bench press. I'll do a set with the bar, and then I'll get maybe 2 10-pound dumbbells and do it. You could do it with, I have this handy pipe here. This is perfect. You do not want to go too heavy with this. It's a difficult movement in the sense that you're probably going to have maybe some restrictions or it's just going to be tight in some places. So you definitely don't want to load this too much. You don't need a lot of weight. Honestly, I'd recommend just starting with your arms, see if you can even complete the movement path. One thing I want to say, cues before I want to say that I'm thinking of before when I'm starting. I want to keep my shoulders in my back pockets. What it's going to do is help keep our shoulder blades down and back, which is precisely what we want to do when we're in the bench press.
So when you say down and back, what muscles are we talking about?
Specifically our scapula.
Stabilizers.
Our scapular stabilizers are going to be on and making sure our scapula don't move around our shoulders while we're pressing.
So, clue, no upper trap.
Yeah, no upper trap. That's why we want to say down and back. So turn all of this off because this is going to keep us up here hunched. So let's start.
All right.
So what we want to do, say this is the bench. We're going to lay down on the bench with maybe our clavicle or upper chest hanging off the bench. If we have dumbbells, we have a little rod, a dowel, a broomstick, that's perfect. We're going to think about having our shoulders in our back pockets, which is going to activate or turn on our back. So shoulders in our back pockets, or you can think about bending the bar, bend the broomstick, bend whatever you want to do.
So in other words, you want to externally rotate. You want to turn your arm in the socket. You want to kind of move it out. So you're going to activate this and you're going to bring your shoulder blades down in that fashion. So you're trying to keep this in a neutral flat area, which in John is not because he's just worked out so much.
So,
and then probably the other thing, how about here, John? This you should not be feeling it in your lower back. If you are, you got to fix that.
Yes.
So there's probably a little bit of a tilt that
Yes.
has to take place. So
Yes.
watch out for that.
So shoulders are down and back. We're going to bring this straight, a little bit, straight back. Still bending the bar, so having our shoulders back. We're going to bring it in front of our head. We're going to press out and come down. Straight back, over our head, out, and straight down.
So here's what I'm seeing from my perspective. You want to make sure that you're not extending your neck up.
Yes, don't look down.
You do not want to do that. So everything, your spine is in a neutral position. You're not feeling it in the lower back. All you're working out is basically you're going through essentially all the directions involved in circumduction of the shoulder joint.
Yes.
So you're going through different shoulder mobility exercises while holding the rest of you in the proper neutral format, right?
Yes, precisely.
This scares me a little bit. So you need to get a clearance, I think, from your doctor. If it's me, obviously I'll let you know. And just to make sure that you don't go crazy, because typically when people are coming fresh from an injury, they have a lot of other imbalances. Fresh from injury doesn't mean you just went in and you did a rehab to your shoulder joint and now you think you're all set. That means now you need to clear everything else that has to do with your shoulder joint before you go back and do your workouts there. So hope this thing helped. Do you have anything else to say, John?
Yeah, I want to emphasize not going too heavy. You're already going to look a little weird doing
Yeah.
this. So no one, I promise you, no one's going to care how much weight you're doing it with because they probably haven't done it themselves. This is purely just to get back to where we are and activate what we need to activate, do what we need to do. So like I said, little rod, broomstick, 5 to 10 pound weights, that's all you need.
Great. Thanks for watching. If you like what you saw, please subscribe to the YouTube channel and share it with your Buddies, make sure you're doing your exercises properly and safely, because there's no fun in getting injured. Thanks for watching, and take care.